thanks the organizing committee, Dr. Sahu, Dr. Dwivedi. Thank you so much for inviting me and so that I can share my experience with you all. And we all know that our first topic is it's not the first, but it's the last topic, and the topic is IASTM and the effect of IASTM on low back pain. So let me share the screen with you all. I can't share the screen. Is it visible to all? Okay. So, so today's topic is, first of all, I'll explain you what exactly IASTM is and how it affects. So you can practice this IASTM to any condition, to any muscles, to anything. But today, I'll talk about what are muscles you need to target in low back pain. So first of all, what IASTM is? IASTM is an advanced technique. We call it as an advanced technique, but it's not that advanced because it's a very, very old technique, which previously it is called as gua sha. And then we'll talk about a little bit of history, how to take care of tools, what all kind of tools are there, what are the contraindications, what are the indications, clinical applications, and then if you have any doubts and all, then we talk about low back pain and what all muscles we need to target. So let's start with what exactly IASTM is. Basically, it's a myofascial therapy, myofascial release therapy. But what we are using in this is the tools. So it's a non-invasive form of manual therapy to mobilize the soft tissue structures. See, the most important thing is you have to understand it's non-aggressive yet effective procedure in which the instrument is used to stimulate a soft tissue structure to relieve pain and discomfort and to improve the overall mobility and function. So the advantage of this therapy is that, see, we all know what MFR is. We are doing myofascial therapies and all, but the most important advantage is that we can use this therapy along with the exercise therapy, so that you can shift the patient from the initial phase of rehabilitation to the advanced phase of rehabilitation. In the further slides, I will show you that how to progress. Even there are progressions in IASTM. How to progress with IASTM, I'll explain you that. Now, IASTM, it is like nowadays they are saying like it's an advanced therapy, but it's not, because if you see the history of IASTM, previously it was called as gua sha, which means scrape, scratch, or sand technique. Even this is also known as coining, spooning, or scrapping. So there are multiple names of IASTM. There are multiple brands who are promoting IASTM. So anything, if you are using any kind of instrument and trying to release the myofascial, it comes under instrumental assisted myofascial therapy. If you heard about different brands like Graston's technique, then there are terminologies called this fat abrasion techniques, hawk grip, fibroblasters, adhesion breakers, ceramic spoons. So these all things comes under only one single topic, that is called IASTM. You can, whatever name you want to give, it's absolutely okay. You can build your own brand, you can trademark that brand, but that's absolutely okay. But it all comes under one main heading, that is an IASTM. Now, what is the most important thing is, what is the theory behind IASTM? Now, the theory behind IASTM is it was based on a Cyriax concept of a cross-frictional massage. The goal is to soften or break up the scar tissues by providing movement to the tissue itself and increase the tissue temperature. We all know that if there is an increase in tissue temperature, what exactly it does? It warms up the area. There is a histaminic response over there. you are creating basically, and it's an induced inflammation what we are doing, increasing the blood circulation over that part. You might see a little bit of erythema over there. And now what exactly it does is, the collagen, being the basic fiber of the soft tissue, needs to lay down parallel to each other to provide rigidity and strength in the mechanical tension. Now, there is a hypothesis that the cross-sectional massage will not detach the fibrils during healing, but instead it will prevent their adhesions at the abnormal sites. So basically, it is helped to prevent the adhesions, but definitely it will not detach the fibrils. So basically, we are not breaking anything. What we are doing is aligning things. We are trying to enhance the healing by improving the circulation over that part, which we also called as creating a micro trauma, and it's an induced inflammation. So now the most important thing is how to take care of the tools. So there are different tools. You might see a big bar. There is a tool, something like this. There are names for that. You can give your name also. That's nothing which you have to remember those things. Or if someone says like this tool is for tendons, or this tool is for muscles, or this you can use to whatever way you want to do it, but it's not like that. You can't be specific with the tool. Remember that. So if I'm using this tool, I can use it on quads, I can use it on a smaller muscles, I can use it wherever I want. This is the most important thing. So there is nothing specific. It all depends upon practitioner to practitioner. Whatever he is trying to do it, he wants to achieve, he can do it. Now, the most important thing while using the tool is, I'm really sorry, just give me a second. I hope it's more visible now. Yeah. So yeah, where were we? How to take care of the tools. So it is the most important thing is while using the tool, because these are stainless steel. It's a high quality stainless steel. So whenever we are using these kind of tools, it's the most important thing is try not to rub the tools towards each other. Like don't try to keep it together, because otherwise it will hit to each other. And the edges, the most important thing is while using the tool, the edges should be preserved. If there is any issue with the edges, the patient will feel a lot of pain when you try to do the IASTM. Do not drop the instrument. Clean the instrument with alcohol rub, or with soft cloth, and clean it with every patient. Like if you're treating one patient, clean it immediately, then use it on the other patient. Keep it in a carry case or protective containers. So it is important. So try not to keep all the tools at one place. Always try to use the container, or try to keep it separately, or use a case. Yeah, so this is, I already explained you. There are different names for this technique, but basically it is called as an IASTM because you are using an instrument to release a myofascial structures. Now, what are the clinical indication for IASTM? Myofascial pains and restrictions, soft tissue injuries, decreased range of motion, you can use it. Very, very effective. Scar tissues, facial restrictions, post-surgical and traumatic scars, tendinosis, ligament pain, and edema reductions. Now, it all depends upon the amount of pressure you are using. I will explain you everything. Relative contraindications, cancer, burn scars, pregnancy, medications, especially anticoagulants. If someone is on anticoagulants, if you try to rub it again and again, there might be a lot of bruising you will see. So try not to use the ISTM when the person is on anticoagulants. Varicose veins, and especially autoimmune disease. Absolute contraindications. Open wound, don't use it. Thrombophlebitis, uncontrolled hypertension, inflammatory conditions due to infection, contagious or infectious skin conditions, hematoma, myositis ossificans, osteomyelitis, and unstable fractures. Evidences. Now, these are some evidences which shows that IASTM cause a cellular response in fibroblasts to lay down a collagen along lines of stress. IASTM when you combine the IASTM with exercise therapy gives a better result. It also reduces. Now, this is the most important part because practically I'm also a myofascial expert, and I'm using, and it's been many years I'm using IASTM. What I have seen the difference in the practice is that before it was like 3, 4, 5 patients I was using manual therapy, and my hands are like, my pain in my hands like anything. But the moment I shifted to IASTM, the productivity improves. Now, this is what I will suggest, that whenever you're using an IASTM, any practitioner is using, basically you are preventing yourself, you are preventing your hands, you are reducing the fatigue and the damage to your joints or to the muscles while treating the patient. So it is like, it's a common sense that if I am not comfortable while applying any kind of technique, how will I give comfort to the patient? So for that, if you switch to a basic myofascial therapy to the instrumental assisted myofascial therapy, you will see that the amount of fatigue in your case is very less. The damage to your thumbs, to your fingers, to the other part of the body is less. The effectiveness of the treatment will increase. You might show something different to the patient, that this is what special I'm doing to you. And it is, helpful in many, many ways. Now, what are the benefits? So overall treatment time reduces. Obviously, I'm doing a myofascial therapy and then I'm using an IASTM tool. I will get, the inflammatory response more earlier than a myofascial therapy. The faster recovery or rehabilitation, reduces pain, promote mobility. And again, I'm saying, if any technique you are using and it's giving you trouble, then definitely that technique is not good for you, because if you are not good, obviously you can't do good for the patient. Now understand this main thing, that the most important person in the clinic is you. So if you're treating the patient and if you are not in good shape, obviously you can't treat the patient properly. If you are having trouble while using any technique, then obviously the technique is wrong. It's not that it will not give result to the patient. Obviously it will give result to the patients, but the most important thing is that you have to be properly trained and proper, in a good health. Then only you can treat a patient. Now, what are the criteria how you can start the IASTM? So the most important thing while when you start the IASTM, to warm up the area. Now, warm up doesn't mean that that you can just apply the hot pack and warm up the area. You can use an IASTM trying to stroke the patient. That's also you can warm up the area. And the second way is that you can tell the patient to walk a little, go on treadmill or do a cross trainer, or you can go for cycling also to warm up the area. After that, apply a small amount of lotion. Don't just, fill the patient with lotion or gel. A little amount of lotion, and then try to give a gentle strokes. Identify the edge of treatment. So it is the most important thing, that which part you are basically treating. So if the part is bigger, then obviously I will use a bigger curve to treat the part. But if I will use a small tendon or something, there are multi-curve tools are there, which I don't have right now, sorry. But you can use a multi-curve tool, which again in different sizes, small, medium, and large. So according to the size, you can just use the tool, identify the edge, and then treat the part. Keep the angle of the treatment at least at 30 to 60 degrees. Don't try to keep it too steep so that it will trouble you, or don't try to be so flat that it will not give any result or you will miss the trigger point. So the most important thing is try to keep it at 30 to 60 degrees so that at least you can give a good results. Apply light pressure through the instrument. Don't poke the patient because you're using a metal over a patient. So it's very important to use a light pressure. Basic scan of the body to find the adhesions. So there are two ways. Either you can use your hands to find out where the knots are, or use the tool as your diagnostic tool, because it's not only a therapeutic tool. You can just scan the area. Let's say I'm using, if I have I'm treating a forearm. So what I'm doing is I'm trying to scan the area with the tool. What I will find is that if there is any knot or there is any stiffness or adhesions over there, I will definitely feel something different. And that's how I'm scanning it. And when I'm scanning it, I'll get the area that this is the area where I have to treat. Then use the instrument and stroke for a precise, focused treatment. It should not like, don't just massage the patient. Like, don't just rub the tool all over the body. It's not, obviously it will give the result, but you are not specific then. So try to be specific when you are using the tool. So if I have the knot over there, then I'll be more focused. And again, I'm saying, this is the basics. Warm up the area, don't forget it. Small, less lotion you can use. Identify the edge, angle between 30 to 60 degrees, just light pressure. Find the adhesions and then be precise. Don't just randomly stroke the patient. Now, there are different types of strokes which you can use. There is a technique called brush stroking, sweep stroking, a fan stroke, you can strum, or you can J stroke the patient. Now, what are the difference between these strokes? I really want, this is not as hard as people think that IASTM is tough. It's not tough at all. It's just need practice. So you practice it, and if you know myofascial releases, it's one of the best thing to use as a manual therapy. So what a brush technique is. So in brush technique, what you can do is, so let's say if I'm treating a part, let me see if you guys, just give me a second, guys. Yeah. So let's say if I'm treating a part, so for now I'm using my forearm. So what a brush technique is, basically it's like you are using a brush while painting. Light, gentle strokes. So brush technique is also used to warm up the area. So if I want to start the patient with an IASTM, what I'll do is I'll try to just, this is what I will do. So I'll go in all the directions. I will just brush the area. I will just warm up the area to increase the blood circulation. Muscles will go relaxed. You can use a brush technique to desensitize the part. And then what is the difference? What is the difference between then brush stroke? You got it, what the brush stroking, basically you are just going in all the directions to warm up the area. Now sweep. So it's like, it's a technique where you're just going in one direction and slowly come back and going again. So basically what I'm doing is sweeping. So you will see the difference that for now, I will show you that this part, there is no inflammatory response right now, but initially, if I go for brushing technique, and I'm not using lotion right now, but still, you have to use the lotion. So if I go for a sweeping technique, I'm not losing the contact, but I'm not putting pressure when I'm going up. What I'm doing is giving a pressure, a slight pressure at 30 to 60 degrees angle, and then I'm going down. Now, with few strokes, you will see the difference. You might not see, but there will be a slight redness around this area. So this is what a sweep strokes are. Now there is fan. What a fan does is, if you are applying a blade over a part, then what you are doing is giving one side of the part is stable. So you are not allowed to move the one side. Now after that, the second side, you're going like this. So basically you are making a fan. This is what the stroke is. So fix one end and then try to move the other side to release, or it's, again, I'm saying it's a cross-frictional massage technique. So basically what you are doing is fixing it and then giving the strokes. So this is a fan technique. In strumming, basically it's like multiple strokes at one particular point. So let's say I found a spot here. Now what the strum is basically, I will try to, the drummers, they strum. Strumming is that, or the guitarist. So when you are strumming like this, so it's the same technique. What you are doing is trying to do a strumming at the specific precise spot. So if I have a knot here, now depending upon whether I'm using it like this, like a pen, or if the tool is bigger, the area is bigger, I will use it in this way. The handling of the tool should be soft. You should not hold it so hard that it should print it on your finger. Don't try to use that. So just keep it soft, grip it softly, and then try to strum. Now, depending upon all the things, whether you're using a brush stroke to warm up the area, whether you want to break the adhesions along the line by using a sweep stroke, whether you can fix one end and try to, this is something it looks like. So basically it's a fan stroke, or if I have a knot here, what I'm going to do is I'm trying to strum that area to break the adhesions. And the last is J stroke. If there is any bony restriction, especially around the, I love this technique around the scapula. So the lower border of the scapula. So I go all the way down, and in the end, what I'm making is a J. So I go all the way down and making a J. So it's like something like this. Or if I have a edges like this, so I will go like down and then making a J. So that's what a J stroke is. So now you got an idea. So again, there is nothing specific about the stroke that you have to use the stroke in this particular conditions or something. No, it's not like that. Again, I'm saying neither about the tool, not about the stroke. So you can use any tool over any condition, over any part. But again, with the practice, you will get to understand that, yes, this part will get released better with these kind of boomerang tool, or you need multiple curve tools, or maybe a handlebar. That with the practice, you will get to know. Strokes, whatever strokes you can use. If the patient is in acute pain, you can use brush technique to just desensitize the area, give a gentle stroke so that the patient feels better. If you feel that the problem become more chronic, the adhesions are harder, you can use sweep, fan, strum, even a J stroke on that. All depends upon you. Let's move forward. Now, what is the treatment response? What you should expect from the IASTM? I have written pain, but while using an IASTM, you should not, pain should not be there. So whenever you're using the tool, if the patient saying, I'm feeling pain, then it's a no-no. Don't ever try to create pain while doing that. Means the pressure is too much, you are harming the patient. Don't do that. Patient is already in pain. We need to calm down the area rather than giving most trouble to the part. So basically we need treatment, not torture to the patient. So we are here to treat the patient, not torture the patient. Petechia, what petechia is? Basically it's, if you see the second picture, if you see this second picture here, this is what petechia is. This is a normal response of the IASTM, normal response, because basically what it happens is there is a micro trauma to the capillaries, and because of that you will see these kind you will see this kind of response. This is still okay, but if something you are seeing this is bruises, not at all allowed. That means the pressure is too much and you are damaging the part. We are not allowed to create or do harm to the patient. So the first thing, the Hippocratic Oath, I think everybody knows. The first thing is do no harm. This is the first thing which we all have to understand. So if you're using any kind of technique, if you have doubt, just avoid it. Because if you're not doing good to the patient, again, I'm saying do no harm. The first picture here shows that we are doing harm to the patient. Not at all accepted. Petechia is a normal response. Patient should not feel pain. So the stroke should be gentle. Arrhythmia is okay. But if this kind of response is there, like bruises, it's a no-no. It's a big no. Let's move forward. Now, how you can progress. Now, the important thing is that there are phases. You can see the most important thing everyone knows, that assessment is important. Whenever you are assessing a patient, you have to see what condition he came up with. Is it acute? Is it subacute? Is it chronic? On that basis, you have to, I'm not here to tell you, I'm here to tell you how IASTM works, but I'm not the person. If you are treating a patient, you are the first and the right person to plan the treatment program. So you decide the treatment program, how to go about it. Now these are the phases. You have to see which phase the person is
in.
So that you can design the program accordingly. Now the first phase is that the soft tissue should be the soft tissue evaluation and gentle treatment to desensitize the dermatome, and the patient responds to the treatment by using a tissue response by taking the slag. So basically, what the first phase is that the part should be in a fully relaxed position, no stretch, nothing. Even you can put a slight slag also. You can create a slag and then try to release the part. So let's say if I'm releasing my forearm, so this is fully relaxed position. What I need to do is to desensitize. I'll use a brush stroke. I will go slight strumming strokes here with a slight strumming, or I can go for a fan strokes to desensitize the area, because I know the patient is in excruciating pain. I need to desensitize the area. After that, once I desensitize the area with like 2-3 days or 2-3 sessions or 4 sessions, 5 sessions, after that, what I have to do is then I can slowly go for the movement. So what I will do is I will try to tell the patient, or passively, first I will go for it. So passively, I will stretch the patient, I will stretch the muscle. And then after that, what I'll do is try to go for all the strokes, whatever I feel like it's important for the patient or give a good results, I will go for those strokings. The third phase is, it's more of when the person is in rehab phase, or when the person can do the exercises and can go for active releases. So basically the first is do nothing. Muscle part is in relaxed position when you are going for the strokes. Second phase, I'm passively stretching the part and then going for the strokes to the patient. Third is, what I can do is I will go for the movements now, because now the pain is less. What I need to reduce is the inflammation, and I can go for more a vigorous approach, you can say, or more active approach. So then what I will do is I will try to move my blade along the movements. I'm going back, stretching the part, coming up, coming back again, stretching the part, something like this. This is an active approach. So you can use an active approach on any patient. If you feel the patient is already pain-free, there is mild stiffness, you can use it on quads, calves, anything. But again, you have to see which phase. You are the right person to judge which phase he is in, and then choose the progression accordingly. You can use it while doing lunges, you can use while doing isometric. So you can use IASTM tool in closed kinematic chain exercises, in open kinematic chain exercises. If you feel there are issues over there, choose the treatment accordingly. Now, the most important thing, I really discussed this in my workshops and all, that people say I stretch IT band, I'm stretching IT bands, I'm stretching plantar fascia. I was going through a research in 2008. It was a research in 2008. Only to stretch IT band by 1%, it requires 925 kgs of pressure of weight. And if you are stretching plantar fascia by just 1%, it requires 460 kgs. Now, if someone says I'm stretching and I'm lengthening the IT band, I doubt it, because I don't think so a human body can generate this much amount of power while stretching even a plantar fascia or an IT band. So basically what we are doing, we are just calming down the area, we are increasing the circulation over that area, we are creating the blood flow over there so that the healing will improve. This is what exactly we are doing. We are not stretching or lengthening the part. It's not, see, the research is there. So that means if you can generate, for that you need something electronic or a big machine to generate that much amount of power. But human body, it's putting a pressure of 925 kgs, it's not possible. Let's move forward. Low back pain. So let me quickly go through all the about the IASTM and all these things. So it's a myofascial therapy. It's a quick summary. It's a myofascial therapy. What you are specially using is a tool, whether it's a metal tool or something else. Even some people are using a wooden tool also. In gua sha, people use wood before to release the muscles. And after that, we talked about how we can use the tools. So basically, you need to clean up the tools properly. You need to use alcohol rubs. Then don't bang the tools. Keep it in a proper safe. Then we talked about how to prepare the part by warming up the areas, taking a small portion of gel. Don't try to use too much of lotion, because you need a grip also to break the adhesions or to warm up the area. Then we talked about basically about the different type of strokes. What are the different type of strokes? What are the different type of tools? Is basically, this is a boomerang. There are different type of tools, multi-curve, handlebars. And then we talked about the treatment response, what we need, what we don't want. And then we talked about the progressions, that what are the first phase of rehab, what is the second phase, what are the third phase. And you can choose the treatment program and protocol and design it accordingly. And we talked about one of the research, which someone says like IT bandage, something like that. And now we'll move to the low back pain, very, very common problem. And we all know about like most of our OPDs and clinics are full of low back issues. And we know that like how much muscle is taking part of in low back pain. If the muscles are not responding properly, if there is a serious muscular imbalance is there, if there is a low cross syndrome, if there is a disc issues, if there is facet joint arthropathies, muscle sprains, ligament sprains, muscle strain, ligament sprains, disc issues. So these all things can cause low back pain. Radiculopathies when the nerves are involved. Now, guys, we are talking about, again, you have to understand, we are talking about the passive treatment. So obviously this treatment is half. So if we are using any kind of myofascial therapy like cupping or needling or IASTM tools or anything, these are passive therapies. In the end, what will give you a sustenance result is when you put the patient into exercise therapy, and that too, depending upon what kind of exercise you have to start from. Again, for that you need an assessment. Maybe we'll talk about this some other time, but right now, the most important thing is when you done with your myofascial therapies or a passive treatment, but it is always important to put the patient into active therapies. So low back pain is when you balance the mechanics and when you activate the muscles accordingly, you can still sort the problem. But what to do with IASTM when there is a low back pain? Because when we talk about low back pain, I personally prefer IASTM tool over it, because there are big muscles over there. Using my hands or thumb, digging it into the muscles will give so much trouble to me. And again, I said, like, I'm the most important person in the room. If I'm not happy, if I'm not comfortable, I can't give comfort to the patient. So let's start with the first muscle. We will talk about these three muscles: erector spinae, thoracolumbar fascia, and quadratus lumboris. Dr. Sahu, am I audible?
Yes, you are audible. Bus, hello.
So you can just give me should I continue? Okay, sorry guys, just give us a second. About erector spinae, we all know that erector spinae is a very, very big muscle. So yeah. So I'm not going into the anatomy of the erector spinae, but you can all see that it starts from down below from the sacrum area and goes up till the nuchal line. There are three main muscles. How I remember is I love Superman. That's how I remember, or I can see one on the as a picture. So you can say I love Spider-Man. That's how I remember. So it's I is iliocostalis, which is the most lateral part of the muscle. Then longissimus is intermediate, like the center part of the muscle, and the most medial part is spinalis. So this is how I remember. So if someone talks about like erector spinae, so there are three major muscle groups: iliocostalis, I, longissimus, love, spinalis, Superman or Spider-Man, maybe. So when we are treating this, you should know. So whenever we are using the IASTM tool, the anatomy is the most important key. Like you should know from where it starts. You have to go throughout the course, because you need the scanning also to find the trigger points. When you don't know what to find, you just rub all the area, which is not good. It's not a professional way to treat the patient. So what you have to do is you need to know what the course is. You scan the area, find the trigger point, then choose the strokes accordingly. So let's say if a person is coming to you with severe pain. So now see, it's all about a common sense, guys. It's not about like if I'm telling you to put the patient into that position, that will go, not at all. So if a person is coming to you with a severe pain in the low back. And then what the progression is, we already talked about progressions. So what I will do is, if the person is not able to lie down on the bed, I might tell the person is to just sit, expose the area, use a slight lotion to the tool, apply it, just give us gentle strokes. Allow the area to warm up, to desensitize. We are not obviously desensitizing the area, because you have to check whether the inflammation is very high or low. Accordingly, whether the patient can take it or not. If the patient can't take it, use a brush stroke to just desensitize it, because gentle strokes will definitely calm down the sensitivity of the area. Now, further, the patient feels better, like, yeah, I can move better. Now, the main function of rectus spinae is to create extension to the spine. Now, my second phase is, if I want to take the patient to the second phase, now what I'll do is, I will take the patient into a child pose position. I will put the patient into a child pose position, hands forward. Now, what I did is, I lengthened the area. Muscle got stretched. Now, in that stretched position, what I will do a gentle strokes, whether I can do strum, whether I can do J strokes, whatever strokes I want, I can go for it. And in that case, the advantage is then the muscle length is already there. Now I'm giving the reinforcement with the IASTM tool, plus it will also improve the joint mobility, because the person is in stretched position. Now, third phase is when patient says, yeah, I'm absolutely fine, I can move better, the pain is very less. Now, in that case, the third phase is, I will tell the patient to go in all four position, in the quadruped position. Now then, the movement will be, I will take the patient I will just instruct the patient to go into a child pose and come back. While the person is doing that, I will just gently stroke the area with my IASTM tool. So when the person is going down, and the most important thing, don't forget to tell the patient that breathing is the most important thing. Don't just randomly stroke the part. Tell the patient to breathe in, breathe out while movement. That will give a better control. So basically, a person is doing the mobility exercise along with that breathing, and you are side by side giving a gentle strokes to the area to give a better results and to improve the flexibility and joint range of motion. That's part one. So we talked about all three phases. First one, patient is in relaxed position, no movement, nothing. We're just giving gentle strokes, maybe brushing. In second phase, we put it in a stretched position like a child pose. Third phase is we are doing a movement from quadruped position to a child pose. Second is thoracolumbar fascia, a very big fascia. It's a large area of a connective tissue, roughly a diamond shape, which comprises the thoracic and lumbar part of the deep fascia, enclosed the intrinsic back muscles. Now, how to the treatment, the IASTM strokes you can give is exactly as same as the rectus spinae. The way you treat the rectus spinae. In rectus spinae, you have to be more close to the area. You have to find the muscle girth. You have to see the orientation of the muscle and then stroke it accordingly. In thoracolumbar fascia, again, you have to see what the original insertion is, from where it is connected, what all areas you need to treat. If you are treating back or the lumbar area, the lumbar part or the thoracic part, all depends upon you. Whatever strokes you decide is absolutely okay. There is nothing wrong or right. You just have to be very much cautious about the pressure you are putting, the angle you are taking, and how much lotion you are applying on the patient, because we can't just put a lot of lotion and then try to stroke it, because then you might not get the proper grip or angulation. Again, if the patient is too much pain, again, same thing on the tummy or maybe in sitting position, then you can move to the child pose position and then slowly shift to this movement-based patterns. You can, again, I'm saying you can modify it by, let's say, if someone is saying, like, if someone is fat, then you can't tell the patient to go into all four position and then come back to the child pose, because the stomach will be the issue. Then what you can do, you can modify the treatment by telling the patient that just go for a segmental rolling, go down and come up, go down and come up, try to touch the floor and come back. So in that case, you can go with a gentle strumming to the back, and then that's what I'm saying. So you can modify it with person to person. That all depends upon you. You can modify it the way you want. But again, I'm saying the first rule is do no harm. If the patient is feeling uncomfortable, if he's just in discomfort, if the person is feeling pain, it's a no-no. Don't create any kind of position or movement in which the patient is feeling pain. The last one is, this is how you can, this is again the thoracolumbar fascia, quadratus lumboris muscle. Very, very important muscle. Most of the time, when there is a back spasm or something, quadratus lumborum muscle comes in picture. For reason infections, again, I'm saying, not going into the anatomy part. The action is side bending. I don't think so, because with such background of what exactly IASTM does, what are the different phases or progressions of IASTM, I can trust on you guys that you can modify the positions and everything, because if the person is in excruciating pain, you know what position you can put the patient is into. It might be because of the sideline position or prone position, depending upon you, and then you can modify the position by shifting it to one side in a child pose position. Then the patient to go into one side and try to release the muscle, and then by going into more movements, let's say if I'm making the patient to sit in this position, and then this is a QL muscle, and after that what I'll do is I will keep my blade over there and then go for the side bending. Along with that, I will go for gentle strokes to the part. So this is all about that. Even if the patient feels like the stroking is a little tough for them, you can go for an ischemic compression to the part and use an IASTM. You can use MET while using an IASTM. It all depends upon you. Whatever techniques you can combine IASTM with, you are free to do that. I think, yes, this is how it looks like. The first picture is you are palpating it. You can palpate it with the IASTM tool also. And then you are treating the patient in a prone lying position, in side lying position, in sitting position. All depends upon you, because you are the right person to guide the patient and to plan the program accordingly. So if you guys have any doubt, anything, any queries, just let me know. I think I'm done with my slides. Thank you so much, guys. And if you have any queries, any doubt, just let me know. Thank you so much.
Thank you, sir.
Thank you so much, sir. If anyone